Hello. Before we begin, I'd like to note that this event is for U.S. audiences only. It is intended to be viewed as it was originally produced by Pfizer. This event has been paid for by Pfizer, and the participants have been paid for by Pfizer for their time. The information provided is for educational purposes only and is not intended to replace discussions with a healthcare provider. My name is Dr. Hansie Mathelier. I'm a cardiology specialist at Penn Medicine, specializing in amyloidosis, cardiomyopathy, and congestive heart failure, among other conditions. Today, I'm joined by former NBA player and coach Don Chaney, along with his wife, Jackie. Don is teaming up with Pfizer on the Voices for the Heart initiative to raise awareness of hereditary transthyretin amyloid cardiomyopathy, or ATTR-CM. Please note, I am not Don's doctor. I did not diagnose, nor do I treat him. Don and Jackie, please introduce yourselves.
Thank you, Dr. Mathelier. My name is Don Chaney. I'm a former NBA player and coach, a husband, father, and grandfather. I also have ATTR-CM. I appreciate the opportunity here today to share my experience.
And I'm Jackie Chaney, Don's wife and primary caregiver.
Thank you. So in my practice, I diagnose and treat patients with ATTR-CM, which is a serious and often missed condition that affects the heart and is associated with heart failure. ATTR-CM is a condition in which certain proteins change shape or misfold. These proteins can build up in different parts of the body. Over time, when these misfolded proteins build up in your heart, it may lead to ATTR-CM. ATTR-CM is a progressive condition that worsens over time. Can you tell us how you found out that you had ATTR-CM?
My mom and grandmother both passed away from heart disease, and I was worried that I may be facing the same issues as them. I underwent several tests and procedures to figure out what was going on, which is how I was diagnosed with heart failure. What my cardiologist and I didn't know yet was that I actually had this heart condition called ATTR-CM. It wasn't until 2019 that I was officially diagnosed.
Don, what were the symptoms that you're experiencing?
I had been experiencing frequent heart-related symptoms for a few years, like fatigue, irregular heartbeat, and shortness of breath. I was prescribed medication, but it only made me feel worse. Looking back for about 10 years, I had also suffered from carpal tunnel syndrome, which is numbness, tingling, and pain in the fingers, knee pain, and swelling in my ankles and lower legs, but assumed these were caused by my years of playing professional basketball.
Jackie, how did you feel as you witnessed Don experiencing these symptoms?
Well, his symptoms had me very concerned and anxious. I saw signs of him being tired and having lower energy than usual. Then he started to have heart and other problems like the knee pain. A lot of it, however, we thought it was just from his basketball career and prior injuries. It wasn't until we worked closely with Don's cardiologist that we were able to finally get a true diagnosis.
How did you guys both react of being told about your diagnosis with ATTR-CM?
It was shocking, but also good to know why I was having these symptoms. Like many people, and even some doctors, I didn't know my symptoms were related to my heart condition. So I didn't think to share with them, with my cardiologists or other doctors I had seen over the years. In my case, and for many others, this can lead to a delayed or incorrect diagnosis.
When his doctor finally told us that he had ATTR-CM, it was sort of a relief to me to have it all put together. But of course, it was still a big concern. And it was a lot to take in because we were so unfamiliar with the disease. It took a lot of our own research and conversations with doctors to help us understand what ATTR-CM was. I stayed by his side every step of the way.
It was scary to realize how little I actually knew about the disease. And that's the big reason why I'm sharing my story, so that others who are having heart issues and other symptoms can learn from my experience and be proactive about talking to their doctor about ATTR-CM.
Thank you for sharing your experience, and you're correct, it's very important. ATTR-CM is often missed. ATTR-CM can look like more common symptoms of heart failure, like extreme tiredness and shortness of breath, while other symptoms like bilateral carpal tunnel syndrome or numbness, tingling or pain in the fingers, eye disorders such as glaucoma, Pain or numbness in the lower back or legs due to narrowing of the lower spine may not be typically associated with a heart condition. This often leads to delayed or an incorrect diagnosis. In fact, some people visit up to 5 doctors before getting a correct diagnosis. Don, you have a specific type of ATTR-CM called hereditary ATTR-CM. Can you explain this further?
There are 2 types of ATTR-CM, wild type and hereditary. I have the hereditary type, which is passed down from a relatives. Symptoms can occur as early as 50 to 60 years old and can affect both men and women. The most common gene mutation associated with hereditary ATTR-CM in the US, the 122I, is found almost entirely in African Americans. Around 3 to 4% of African Americans have this mutation. Not all who have the mutation will develop ATTR-CM, but we do know that people with the mutation are at higher risk of developing hereditary ATTR-CM compared to those without the mutation. I know people can be hesitant to speak openly about health conditions or to visit a doctor, but it's so important for patients with heart failure to talk to their primary care doctor or cardiologist about ATTR-CM. If they are experiencing any seemingly unrelated symptoms, for example, irregular heartbeat, fatigue, shortness of breath, carpal tunnel syndrome, or if they have a family history of heart issues and have been diagnosed with heart failure, if I had known and proactively discussed my symptoms with my doctor sooner, I may have been able to get the right diagnosis and started managing my condition earlier with the care of my doctor. Some doctors may not know that ATTR-CM impact Black Americans specifically. So the condition can be overlooked or missed if we don't speak up for ourselves and on behalf of our loved ones.
Thanks, Don. That's such a great point. Additionally, it's important to determine which subtype you have. Once you're diagnosed with ATTR-CM, genetic testing and counseling are recommended to find out if you have the hereditary type. If you do have the hereditary type, it's important to notify your relatives, especially your siblings and adult children, since they could also be more likely to have the disease. Don, knowing that the gene can be passed through relatives, have you spoken to your family about the importance of undergoing genetic testing and counseling to find out if they could more likely develop hereditary ATTR-CM?
I told my own family about the condition and urged them to get the genetic testing. Several followed my advice, and as a result, one of my family members found out she also has the gene mutation. She's now working closely with her cardiologist to monitor any symptoms so they can be prepared to take action and manage the disease if she develops symptoms.
I know that some people may be hesitant to speak with a doctor about having an open conversation with a medical professional is critical to receiving a diagnosis that can help put them on a path to managing the disease. Some doctors may not know that ATTR-CM affects Black, African American, and Afro-Caribbean communities, so the condition may often be overlooked or missed. Make sure to share all of your symptoms, even if they seem unrelated, so that the doctor has a full picture of your past and current medical history to help make an appropriate diagnosis. And if you don't feel comfortable having that conversation alone, bring a loved one to your appointment as a support system to help speak up about what you're experiencing. Don, how are you managing hereditary ATTR-CM these days? Briefly describe what your life is like today living with hereditary ATTR-CM.
After my diagnosis, my doctor and I decided on a plan to manage my disease. I've been able to stay active during my retirement years by spending time on my ranch and working on antique cars. My wife, Jackie, has been my primary caregiver and advocate. I'm very grateful for her love and support. She helped during the diagnosis, and once we knew it was ATTR-CM, she was by my side to help me address it.
Jackie, how do you help Don in managing hereditary ATTR-CM? And also, how has your relationship evolved since this diagnosis?
Once we knew that it was ATTR-CM, I made sure that Don took immediate steps to manage his condition. I have fully stepped into the role of caregiver and advocate. I'm usually present at every doctor's appointment, and I'm proactive in speaking with his doctors and explaining his medical history and symptoms he has experienced. I think Don's diagnosis actually brought us closer in a way because we talk openly about our health now. Going through this together has definitely made us closer as a married couple. We even prompt each other to live a healthier lifestyle. Our family is also a great support team, and that includes our 12 grandchildren who keep us on our toes. He's staying active, managing his disease, and enjoying his retirement years surrounded by his family and friends.
Jackie, how are you managing your well-being as a caregiver?
Well, I try to be there for Don every step of the way, and I really enjoy helping him, especially since he's taken care of me throughout the years. I also make it a priority to still make time for myself and do the things that bring me personal happiness. I love spending time with our children, our grandkids, taking trips to our vacation homes, and spending time with the kids and traveling when it's safe to do so.
What advice would you give to other caregivers whose loved ones have hereditary ATTR-CM?
My advice to others is to help keep an eye out for ATTR-CM symptoms like extreme tiredness, carpal tunnel syndrome, and swelling in the knees and ankles, since your loved one might not be aware, and then make sure that they share all of those symptoms, even if they seem unrelated, with their doctor, so they have a full picture of your past and current medical history. If your loved one has hereditary type ATTR-CM, encourage adult family members to get tested. It's important because these relatives are more likely to develop the condition, and getting tested may help family members find out if they have it sooner and potentially start managing their disease earlier. This is important because it can get worse over time.
Don, what is your advice for other Black people who may be experiencing symptoms like you and have a family history of heart disease?
Black, African Americans, and Afro-Caribbean people have the highest rate of heart disease in the US compared to people of other races and ethnicities. In fact, a 7-year study in London, UK, found a gene mutation, V122I, was the cause of heart failure in 211 out of 1,392 Afro-Caribbean patients. So it's critical to raise awareness of ATTR-CM as one potentially overlooked cause of heart failure among our communities in particular. If you are Black, African American, or Afro-Caribbean, are experiencing any unresolved symptoms, for example, irregular heartbeat, fatigue, shortness of breath, carpal tunnel syndrome, or if you have a family history of heart issues and have heart failure, have a heart-to-heart with your doctor or cardiologist about ATTR-CM. It's important to find out if there's another cause of your disease like hereditary ATTR-CM. It is equally important to have open discussions about health within our families, even if they can be a little bit uncomfortable at times. Although some people would rather not know if they're more likely to develop a disease like ATTR-CM, talk to your family so they can be tested and be prepared to take action.
Finally, can you tell us a little bit about the initiative you're partnering with Pfizer on Voices for the Heart?
Voices for the Heart initiative is dedicated to raising awareness about ATTR-CM in Black, African American, and Afro-Caribbean communities. As part of this program, Pfizer has partnered with trusted community organizations and cardiologists in cities around the country to help connect communities with more information about hereditary ATTR-CM and encourage those with heart failure who have any unresolved symptoms to talk to their doctors about ATTR-CM.
Don and Jackie, thank you so much for sharing your ATTR-CM story with me today.